Hi, I'm Dr. Adam Fields. I'm a chiropractor, and so many of the videos that you appreciate have been influenced by this man, Tim Sawyer, who I've been working with for many years. Today, he's going to help us with some trigger point therapy with a Theracane for your low back pain. Go for it, Tim.
All right, let's get right into it, Adam. Let's start with the Rectus Abdominis. A lot of people come in with low back pain, and they've had their low back treated, but they've never taken a look at their stomach. Very important. So we're going to use this end. You're going to use this end of your Theracane, and you want to make it parallel to the body this way. Perpendicular. The Rectus Abdominis goes from the pubic bone to the top of the ribs here, and we want to gently find the muscle that's slightly to the right.
So I'm
and
going
just
around
below the belly button.
Just below the belly button, just to the right of midline. Oh, I already feel it.
Yes, and this muscle can refer pain into the stomach and also into the low back. But you want to look for a tender spot, and you want to gently hold that down for about 30 seconds.
If you're pregnant, please don't do this. If you have diastasis recti, please don't do it. Oh, that's already released.
Great. And gently lift up and go up about 2 or 3 inches to another spot. You could work your way all the way up the Rectus Abdominis. And gently remember to breathe. After these trigger points, we're going to show you in the next video stretches to go with these. And so it's really important to do the stretches after you've done the trigger point work. And gently release and go up about 3 or 4 inches. There we go.
Can this affect organ systems?
With the gentleness of the pressure that you're providing, there's not really any problem. If you're working on the left side of the Iliacus, which we'll get to, there's some contraindications. You don't want to work on those deep muscles if you have Crohn's disease or diverticulitis or some sort of irritation. And then gently lift up. And then the next one is the psoas. And the psoas runs from the hip to the low back, and it's deep in the abdomen. So you want to go about 5 inches away from the belly button to your right. And again, this is all your right side. Then you want to apply a pressure about 20 seconds downward, gentle, constant pressure. And then you want to tilt the Theracane up about 30 degrees. And then you want to pull across with this arm and down with this one. And you'll hit that psoas belly. How does that feel?
Feeling it in the leg even.
You can get some referral in the back, down the front of the hip, into the leg.
The psoas gets shortened with all the desk work, right?
Anyone who sits for long periods of time gets crazy shortening of the psoas, which affects the low back.
That'll even deactivate your glutes.
It completely deactivates your glutes, so you could notice this with climbing hills or hiking or climbing stairs. You'll feel weak. And it's not because of weak glutes necessarily, it's from this psoas. And then you could back off a little bit and you can go up just about an inch at the level of the belly button. Do 2 spots there.
So come down first.
Yep.
And then
down 20 seconds, tilt to 30 degrees, and push across this way. Excellent. You're holding trigger points for 30 to 60 seconds. You can go up to 90 seconds. As you feel the release, you could gently let off. And again, you want to greet the pain.
Don't bust the door down.
Don't bust the door down. And then the next muscle that's part of the iliopsoas complex is called the Iliacus. And it's just as important as the psoas. So gently lift up on the psoas. Find this bony prominence here, which is called the as-is. And you could turn your Theracane around, facing this way. Yep. And you want to use the same ball. This one is now you're going down.
Just inside the bony protuberance right there.
And you tilt and you go out. So remember, the psoas was down and inward. The Iliacus is down and outward. And if you get a little more angle on it, you'll feel that psoas and the Iliacus right there. So the Iliacus and the psoas are essentially brothers or sisters in arms. They complete the iliopsoas complex. Powerful hip flexors.
And if you're Iliacus is too tight. Maybe the abs don't engage as well.
Right. And you can also get some groin pain when we discuss that later on.
These muscles have such balance of power, right? One is, okay, you got that, okay, you take it. The other one just kind of falls asleep.
It's important to work through all these if you have low back pain. You don't miss any of these and your back pain will slowly fade. And if you have back pain on both sides, then you'll repeat the video and do the same thing on your left side. And now in the same position, we could do the lumbar paraspinals and the thoracic paraspinal. So you want to bend your knees now to take any pressure off your low back. And you could take the Theracane and turn it around so you're using the hook in. And you gently do a pelvic lift and put the ball into where you feel the bony prominences of the spine.
About the level just below the ribs?
Just below the ribs. Now you could back off about an inch into the thick muscles of the paraspinals.
Let my hips go down.
Yep. And some people will feel tenderness at this level. Otherwise, you have to press away.
And just crank it.
And just gently push up. There's always the no pain, no gain attitude when you're digging on your trigger points, but we don't want any bruising, and you don't want to guard against the pain. So just take it slow and gentle, and remember to breathe. It's really important. Breathe in through the nose, out through the lips, until those trigger points just fade away. One other technique, you could do a little row your boat on these, and just kind of come in a circular motion and just give yourself a little massage in there after you do the trigger point release. It feels really good. How's that feel? Great. And if you start at the rib level, you could work your way up a couple inches and you could work your way down. So let's go up about 2 inches. Because these, even though they seem higher, they can refer all kinds of pain straight down into the low back. Beautiful. How's that one feel?
It's just like I worked out and it's happy that I'm taking care of it.
Beautiful. It'll be really important to follow up with this video with the stretch video so that you could do the stretches on all these muscles that we're releasing. And we're also going to show you how to do these same releases with a ball, just in case you don't have a Theracane at home.
So we'll go down.
And then you go down
a few inches, right on that paraspinal, and just pull it right away from the spine.
Yep. And if you're really close to the spine and even down towards the sacrum, you're also getting these muscles called the Multifidi. And those muscles are the closest muscles to the spine. And they could also hurt like crazy.
They're full of proprioceptors. They tell the brain a lot of information as far as positioning sense and tracking your low back, and the mechanics of what your body's doing is really, the multifidi are so important. Okay, let's bring it down a little bit.
Down one more, yep.
Oh yeah, now I'm right at the sacrum, top of the SI even.
Yep, and that's where the paraspinals connect, and that's where the multifidi are really present.
I think I just want to hang out on that one.
These are great. And remember to breathe, take your time. And then release slowly.
Let me go just another 10 seconds. It's too happy right now.
Great. Another group of muscles that refers down the leg and into the low back are the glute medius and minimus. So the glute minimus is really on the side, and you find the trigger point on the side of your hip, and then you slowly roll over onto the Theracane, and you'll definitely know when you get to it, because it is not a fun trigger point to get.
Oh yeah, that's not gluteus minimus, that's gluteus medius.
This one could refer down the leg.
Angry.
This one can mimic sciatica, and it could also refer up into the hip and glute.
It's just dancing. That pain is dancing around. So if you go 2 minutes on a trigger point and the pain hasn't decreased, you're probably going too hard, right?
Right. If you maintain between that kind of 3 to 5 pain level at first, which we call greeting the pain. That's great. After you've watched the videos a few times and you've learned to do this more and more, then you want to add a little more pressure and a little more time, and you'll start to release your pain. And again, as we say in any of the videos, if this increases any of your pain, then you need to stop and consult with your therapist or chiropractor and make sure you're doing things the right way. But the video really dials you in on how to do this, so make sure you repeat it and you follow the rules of engagement. And then to get the gluteus medius, you just roll this, just like we did on the shoulder with the teres minor and the shoulder girdle. Go back a little further on the bigger bulkial glute muscle, roll into it.
A little up higher also.
And a little higher, and you want to push in.
Oh, that one also.
Beautiful. This one really can create a lot of low back pain.
Do you think when people's glute maximus is deactivated, their glute medius starts going crazy and talking?
Yeah, so if their psoas is really bad, they could deactivate their extensors, which is their powerful glute maximus. And so then glute minimus and medius need to step up to the program to compensate. And then low back pain happens.
I hope you guys are feeling what I'm feeling. Because if you are, it's productive.
Take it slow.
Let that face
Breathe
relax
into
right
it.
now. Really, let the face totally relax. Let your toes relax. Let your body just sink into that Theracane.
Beautiful. And this next muscle is a very important low back pain muscle. It's called the Quadratus lumborum. So you're going to want to roll on your side and face this way. And you're going to use one of the side knobs. There you go. And you want to try to find the space that's in between the hip girdle and the 12th rib. And this has a little space right in the waist, essentially. And as you gently push in, you're going to find the trigger points. These trigger points can refer into the abdominal area, they could refer into the hip area, and they could refer into the low back area. The key thing is you want to look for the painful spot and gently release it. How's that feel?
Again, radiation. Again, down the leg, the lateral leg. Can trigger points influence organ function?
I think they can, and certainly in some aspects, and
Digestion.
probably also other way around. Digestion for sure. Trigger points in the abdominal, tight trigger points in the abdominal areas. It's like if you've ever had to wear a tight tux to your best friend's wedding and you end up with just a irritable bowel that night, and the food was all right, but you realize your pants were so tight. It's the same as your abdominals and your back muscles being so tight that it can really influence how your digestive system works. So there's the QL, really important. And you'll really look forward to doing the stretches that are associated with these. So be sure after this video you check that out, because it's really important to do the stretches after you've done the trigger point work. There's one more important stretch that people always forget, our trigger point release, and we'll do in the kneeling position. It's a muscle called the soleus, and it's actually a calf muscle. And you'll get a lot of hikers and runners that end up complaining of kind of SI, low back pain, after big long hikes, because this trigger point in the soleus can refer right into that SI region. Search around and see if I think you found it right there.
Yeah. I think he knows his stuff.
Yeah. Easy to forget this one, and you've probably never done this in relationship to low back pain anyway, so it's a great one to consider. And again, after you've done all these, it's really important to hit the button to do the stretches, because trigger point work, trigger point release, and stretches go hand in hand together. And if you take time to do the trigger point work and the stretches, it'll be about 20 minutes, not a big part of your day.
Right. Make sure you get some time of just non-thought. Trigger points often happen with high stress, right? So look at the clouds, get into water, be with people you love. Take a Sabbath, where you're doing nothing and not looking at your phone so much. Get yourself in a relaxed vibe on a regular basis. Don't just remain redlining all day, every day, because that's not good for your trigger points.
Looking good.
Looking good. That was phenomenal. Again, if you need it on the other side, watch the video again, then do the stretches. Thanks so much for taking care of you, and thanks, Tim. You are amazing.